So you've got to try and create yourself and make yourself in such a position that you are indispensable. So you want someone to smile at you. Why don't you smile at someone first? You want someone to be kind to you. Why don't you be kind to someone first?
Way, because without family you're nothing. So family is everything.
How can you be a blessing to someone else today? I do believe that we'd make this world a much better place.
Hello and welcome to Sisters Talk with Sefin Smart. As we continue to seek normalcy in these trying times, citizens around the world are looking towards their various governments for economic, social and public health guidance. The evident lack of basic resources in developing countries means that strategies adopted in combating COVID-19 will vary. African countries will struggle to tackle this coronavirus pandemic the way the European countries have. Strategies have to be relative. Today, contributors of the program will share their views on the effectiveness of current government strategies and how they would consider doing things differently. Please don't forget to click on the subscribe button. Let the show begin.
I wouldn't say it's been entirely effective, but also it's not entirely the fault of the federal government, or I wouldn't say it rests totally on the hands of the federal government. Reasons being, the federal government is not the only stakeholder in the fight against COVID-19. Well, there are first responders, there's the NCDC, there's the citizens, there's security agents, there's health professionals, and everyone involved in the fight against COVID-19 has a part to play to ensure it's effective. If federal government and the NCDC and all the other agencies and stakeholders set up things to be observed and citizens do not observe these things, then the fight would not be effective. Vice versa, however it happens, if one part of that chain is not carrying out what it is they need to be doing per time, then we cannot say we're fully effective. Another thing also is sensitization. In the city centers, in the urban areas, people are informed because they already have access to information. They have the social media where they could see what's happening around the world. But for people in rural areas, information did not get to them on time, and when information got there, was already polluted by what leaders in those communities, whether religious leaders, whether social leaders, had already influenced them a certain way. So decisions were being made based on the information that they had on hand at the time or initially.
I would rather say that the strategy is not bad, but it hasn't been effective as well. And I will break it down. The first flaw of the strategy is that Nigeria had enough notice about this virus from getting information from China, Europe, and America, but we refused to shut our borders completely. Yes, some part of the land borders were closed, but for almost a month, we were allowing aircraft to land in Nigeria. I mean, that was a flaw. Secondly, another strategy that the government think they deployed, which I know is not effective, is the aspect of giving conditions on how to self-isolate after travel. The truth is that more than 60% or even more of the people who came into the country within that period never self-isolated. There were a lot of there were several examples of people who came in and said, that coronavirus is not for Africans, so why would they self-isolate? But the reality check is that some of these people actually had the virus, and that's why the community spread in Nigeria has increased. Then the third aspect that I think hasn't been quite effective on the approach of the federal government is testing. It's a shame that at this time, about 2 months into the COVID-19 crisis in Nigeria still haven't tested up to 20,000 people in a country of about 200 million. We just have to wake up.
Personally, I don't think the strategies have been effective. A lot of people think otherwise because they think without the lockdown and stuff, we would have been in a worse of position. I feel we are at a bad position. It's just not yet been documented. So, in all honesty, I don't think the federal government has done enough. Not that it is through any fault of theirs. I think the government itself has not understood the magnitude of this virus. It has not understood enough to sensitize people because most of what's happening now, we see a lot of disobedience to the rules, to the guidelines, and that is honestly because people do not even understand what they are dealing with. So we are not making it a priority to to combat this.
Initially, it seemed as if the federal government had gotten it right with the first case, the index case. We did a good job at contact tracing. We did a good job at isolating, and then we started getting people recovered. But I think at some point we went to sleep, and we are paying seriously for those mistakes right now. I'm really worried about what's happening in the north, especially Kano State, and I'm aware that there's a community transmission in almost every state in Nigeria as we speak right now, and some states like Kogi are not even testing at all. What we are lacking is central coordination in terms of policy. We have the health workers on the field. We have enough manpower from what I can see, but unfortunately, we don't seem to have adequate diagnostics. We don't have the reagents, we don't have the test kits, and it's just an indication of a nation that has a weak health system. Until we invest more in our health system and we invest in our research and laboratory capacity, we are not going to be ready for this type of pandemics whenever they come. It's not just corona. Any other one that comes, Nigeria would not be ready for it.
The way the government has handled the COVID-19 response has not been effective at all. One, I don't think we had to wait for a case of COVID-19 to be imported into the country before closing our borders. We could have shut down the airports and seaports earlier than we did. Two, even when the lockdown order was instituted by the government, it was not effectively handled in the sense that we had cases where law enforcement agents took bribes from civilians and allowed them move from place to place. Personally, I watched a video in Lagos where a group of policemen took civilians in their buses, in their van, and allowed them to get money from them and more like transported them or smuggled them from one place to the other. It was not effectively handled. The third thing is, when the lockdown was also instituted, it was not done universally. It was done in a few states because it didn't affect some other states, forgetting that there was still interstate and intercity transportation. So people could move from, say, Lagos to Ibadan, and take somebody that carried the virus from Lagos could go to Ibadan and infect other people. I think it should have been done across board at the same time, and we should have been sincere with the use of our armed personnel or security personnel. They should have been more sincere in tackling it. On the health front, I think that we did not have enough facilities to combat COVID-19. Talk of personal protective equipment for health workers, talk about well-equipped isolation centers and all of that. So I think on the health front and on the security front, it has not been very, very well managed. We have tried, but there's still a lot of room for improvement.
Yeah, I'd like to commend the federal government's effort in combating the COVID-19 pandemic. I'd say, yeah, the federal government has done a very good job. But a few things they didn't get right. For instance, relaxing the lockdown in some of the states, FCT, Lagos, Ogun State. I'd say that was coming a little bit too early. That came a little bit too early. And I hope we don't have to pay dearly for that move by the federal government. Yeah, it's understandable that the federal government had to relax the lockdown due to pressure from hungry citizens who, definitely want to return to their work, to be able to earn a living and all of that. But I think what the federal government would have done, to handle that pressure from the citizens would have been better management of palliative distribution. On the news, we hear the federal government has provided palliatives, this has been given, this has been given. But on the streets, when you talk to people, they all say, oh, they have not received anything. So I think, yeah, the federal government has not done pretty well with regards to proper distribution of the palliatives. I believe if most citizens, were reached with this palliative, I think the pressure on the federal government to relax the lockdown would not be this much, and then the lockdown would have continued for a little longer until we see the numbers of infected cases start dwindling. But as it is, the numbers are actually increasing, and yet the lockdown had to be relaxed.
My response to this question is no, being that borders were shut late. People were still coming into the countries and mingling with others even after we had cases of coronavirus spreading all around the world. Youth tech companies are not well engaged in order to combat COVID-19. Strategies put in place for testing is not enough. Out of 180 million people, we have very low testing rates of just less than less than 10,000 people that have been tested. Some state governments are using using COVID-19 to play politics in the sense that they are priding themselves in not having any single case, which means is either they are not testing at all, or they are testing and they are not telling people.
My wise words are empathy, compassion, kindness, and hope. I challenge people to go out and volunteer in their local communities and to try and make a difference to one person. Empathy. You can show empathy by listening to someone and consoling them while they're grieving. You can show compassion easily by feeding someone that's hungry. You can give someone hope by giving them some water and listening to them as well. And if you can wrap a blanket around someone that's cold and show them kindness, you can make a difference in the world. My name's Helen Zahos. I'm from Australia. I'm an emergency nurse and paramedic, and I've treated some of the world's most vulnerable people. And I'm challenging you all to go out there and help in your community, help around the world. And it doesn't have to be the thousands of people in front of you. It can just be that one person that you help, but you can make a difference. Thank you.
I would first of all say yes and also no. Let me focus on the yes. So the Nigeria Center for Disease Control, NCDC, has largely been working really hard. They have been making sure that the public has been updated on news, giving out information as to what the Nigerian populace can be able to do to protect themselves in terms of social distancing, wearing of protective masks, and the signs and symptoms and the numbers to call in case you have any signs that speak to having the infection. On the aspect of no, well, first of all, we do know that our health system has not been at best optimal. When you talk about funding for the health sector, we're still at an abysmal 4% of the total budget. We are not even keeping to our word for the Abuja Declaration, which mandates and which Nigeria did sign here in Abuja, that the African countries should contribute at least 15% of its budget to the health sector. So what you have is an underfunded health system, which is really struggling. It is weak. That is the truth. It is weak. We're not even compared to other countries in the developed world, and you can see how they're having it hard in terms of trying to manage COVID-19. So basically, we have to start from the basics. Funding has been poor. The strategy hasn't been effective. We have a lot of health professionals even contemplating what will happen to benefits and hazard pays and things like that. Then we talk about the issue about the infectious disease bill that is being proposed. You can imagine a country where we are looking at even the DG of the NCDC saying that he is just finding about the bill on social media like everyone else. And even though he understands that, okay, probably they do have good intentions, but he does not support the signing of any bill in a time of this pandemic. This is akin to like changing the rules of a football game while the World Cup is going on. And of course, on a close look at the bill, you can find certain irregularities. The fact that it was largely plagiarized from another country's plan, which is Singapore, if I think. And then you also have the bill granting very extreme rights to politicians and even security agencies. And you're aware that there are a lot of abuses that have happened since this pandemic happened. This is just throwing back to the fact that we have an issue of compliance and social justice and corruption in this country. So in a situation like this kind of bill only tends to exacerbate the problems of Nigeria. We have people who are putting in their life into this pandemic to ensure that lives are saved, and then we still have Nigerians who are just greedy, bad intentioned, and want to take advantage of the situation. I'll give you an example. You even have a situation where people who are returning to Nigeria are being housed in specific hotels so as to quarantine them, and then you have Federal Ministry of Health officials even conniving with these administrators of hotels to get kickbacks of a certain percentage of whatever is being paid for the room. So it's really sad.
I would say slightly because more could have been done. Yeah, from the onset when the story broke out, the whole pandemic threats, the alarm was sound world over. If we had taken an immediate action as a government, we would have done more. We should have closed all borders and started checking people out like we are doing right now. I also watched a video on what is going on in Abu Dhabi. They have this big tent that, checking people and all that, the tests, the testing for patients or those who've been infected by the virus. If we could put that measure in place, that would be a big plus to this nation, because immediately would just restrict the movement of those who have been infected so that there isn't a transfer. But then Nigeria and the number, where the population is outrageous, to start testing each person, that would be a very, very, very Herculean task.
Yes, I believe the federal government's strategies to contain the spread of COVID-19 in Nigeria is effective in some aspects. For example, the NCDC and Federal Ministry of Health have been working very hard in their effort to ensure that every region has at least one testing center. Their strategy in the distribution of palliatives, this area, I believe, needs to be re-strategized to make sure that the real people that need the palliatives get them. Then other areas that I feel that they should improve is in strengthening their collaboration, partnership. There's need to encourage partnership at this point. The federal government alone cannot do it. For instance, I would suggest that the states should invest in this aspect. For instance, invest in the diagnosis, provide more laboratories for themselves, independent laboratories, while they still work within the policies of the federal government.
Let me begin by commending the federal government, PTF, that's the Presidential Task Force on COVID-19, the NCDC, the line ministries, the health workers, and everyone that is committed to the fight against COVID-19 in Nigeria. In Nigeria, we like taking a fire brigade approach to things. We are never prepared for disasters. We are never prepared for occurrences such as this. If we had put our health systems in order over the years, maybe we wouldn't be panicking the way we are panicking right now. We have also failed to learn from experience. We had initially had Ebola in this country, and with internal efforts we were able to address those issues.
I feel the federal government hasn't been very effective in its strategies to combat COVID-19 in Nigeria. This is evident from some of the challenges we have witnessed so far. First was the lack of effective communication and coordination with the federating units. This we saw after the president announced lockdowns in Ogun, Lagos and Abuja, and shortly after, the Ogun State governor had to request for a few days for Ogun State citizens to prepare for the lockdown. This is a wrong signal, really, because if the presidency did communicate with Ogun State in that specific instance, the governor wouldn't have requested for an extension. Also, there has been lack of proper and effective mechanism in the distribution of the palliatives, as we witnessed people scampering for the relief at the early stage of the lockdown.
When the first few cases of coronavirus were recorded in Ghana in March, my government reactively and rapidly instituted partial lockdowns and restricted movement of people and gatherings. Unfortunately, these instituted measures were either relaxed or lifted a few weeks later when government claimed it had finished its contact tracing exercise and had quarantined all affected persons. I think this was an erroneous act because what government failed to realize was that Ghana had not reached its peak yet. We are still climbing and at a point where we cannot possibly predict the magnitude of the spread of the coronavirus. Today, because of the lifting of the partial lockdowns, Ghana has recorded more than 4,000 cases of the coronavirus. So if you ask me what government strategy has been, I think my government strategy has been merely peripheral and camouflage-like than any serious attempt to tackle the spread of the coronavirus.
I would say that the Ghana government has handled the issue of COVID-19 very seriously from day one. There was an institution of a lockdown which lasted for about 3 weeks. Within this period, the government intensified its contact tracing measures, where they discovered a lot of active cases. As it stands now, Ghana has about 4,000 plus confirmed cases of COVID-19, and amongst this number, about 22 people have died, and then about 300 plus recoveries. In my view, I think the Ghana government has done very well. The provision of PPEs was a challenge at some point, but as we stand, I think that is being taken care of. Some education is happening on our media platforms as to educating the public on the need to observe the necessary preventive measures on how to stay away from not getting COVID-19. So to a large extent, I think the government has done its best, and then they've done well. The World Health Organization recognized this effort of Ghana as one of the top 20 countries in the world with some of the most innovative approaches to dealing with COVID-19. And a Ghanaian who happened to be a friend of mine also developed a kit, COVID-19 rapid test kit, and hoping to get FDA approval to serve the sub-region, the African sub-region.
Going forward, I think we first of all need to recognize the dominant presence of the coronavirus in our countries, whether you are in Ghana, in Nigeria, in Liberia, or anywhere you are across the globe. What we need to do as Africans is that we have to encourage the mass production of the mask, especially using the traditional and then the local cloth, as some people have already started doing. This is because it is much affordable for most people to buy such masks and use them once, twice, maximum 3 times before they buy another one. I also think our government have emergency funds to tackle pandemics such as coronavirus. What we need our government to do is that they have to set up distribution booths in neighborhoods where food items will be given to the most vulnerable, especially the women, the youth, the young girls, and the old people. Finally, I also think that the fight against coronavirus rests with us citizens. We need to police ourselves and be socially responsible to one another. So I think if you can, stay at home and stay safe. If for any reasons you have to leave your house, please wear your mask, protect yourself, and avoid catching coronavirus or spreading it to other people.
More education needs to go out there. Develop education in local languages, in local content. So the message of how to prevent COVID-19 trickles down to everybody in the villages, in the suburban communities, in the hard-to-reach parts of the country. Because the more information people have, the more empowered they are to prevent the spread of COVID-19. But I would say that the government should emphasize and spend more money in developing these. The government should spend more money in developing the message of COVID-19 in virtually every major language in the country, so that the message of how to prevent COVID-19 trickles all the way down to the last person and the difficult to reach demographic of the country.
To get people trained, we need to get people tested, we need to get test kits, and then most importantly, we need to get the information out down there. Once it starts from down there, even your house, your caregivers, your helps, everybody's in the know and everybody's alert and ready to work against this pandemic.
At this point, the options before us are very limited because we already have community transmission, but we still have to do more testing. We need to intensify our diagnostic capacity. We need to invest more in testing. Every state of the federation needs to have an active NCDC testing center, and they must make sure they do contact tracing. They test as much as possible. Unfortunately, we are still reliant on importing reagents from countries because we don't produce our own reagents. So there's nothing we can do in the short time about that. We need to get as much reagents as possible and liaise with countries that can help us to get this. We need to work more with international multilateral organizations like the WHO, like the World Bank, and other multilateral institutions to see as much help as we can get. The monies that have been loaned to Nigeria to tackle COVID should be used for COVID. The palliatives we should make sure that we get the palliatives to the people that need them. And then, that being said, the idea of relaxing the lockdown was a mistake as far as I'm concerned. I don't know how we can rewrite that wrong, but I believe that we need to motivate health workers as much as possible so that they won't get tired in the work they're doing, because it's like they're doing a good job and people are just out there to try and frustrate their work. We need leadership more than anything. So I think if I was in position of power, what I would concentrate on is to provide the right leadership that we need at this time to tackle this problem.
First things first would have been to sensitize and fully educate people. I mean, we have a national orientation agency. I don't know how effective they've been in all of this, but then it is their first responsibility to ensure that Nigerians are informed in every language possible. I'm not saying all 700 or how many 100 languages we have, but at least if we could go to regions and use the most common languages used in communications in those regions and then disseminate this information to people, then people would understand and people would not be coming out in their communities to protest when government says stay at home. I mean, the stay at home order was not for the benefit of one part of society, but for all of us. Another thing I would talk about is the hike in price of essentials that are needed to protect people in this time. Face masks, for example. You know, apart from how difficult it is to get one, and then the cost. It's really surprising that before this pandemic, you know, you could go out and get face masks at, and I don't want to put out any price there, but you could get them, they were affordable. someone who was into menial labor would be able to afford it. But right now, you go to buy this disposable mask is between 400 to 600 naira, depending on where you're getting it. And people are making big money out of a global crisis. Hand sanitizers, in fact, you can't even buy hand sanitizer right now because of how much there's so much hike in the price. And what people do not understand is the masses who you're making this thing expensive for, that cannot afford it now, if they get infected, they are the ones that will come and infect you. As they are making provision for palliatives, the palliatives which a lot of people had complained about, people did not even get the palliatives. These are the essentials that people need first before they can even stay alive to eat. If people must go out, give them the mask they need to be out. You must not provide them with sanitizers. But if they are able to protect themselves first, then palliatives should be made available. The palliatives is another whole story. I mean, banks were giving out money to the federal government, and you have records of people in this country that bank with you that do not have up to 5,000 naira in their accounts. And banks, I don't know for what reason they felt it was okay to give all of those monies to the federal government. Now, what is the money going to be used for? We hear it's going to be used, to supplement budget. Is that what the money was meant for?
The improvement I would like to see on the federal government strategy is to increase the level of testing. If Nigeria can increase testing alone, we are sure of putting COVID-19 in control in Nigeria. A lot of people move around today without knowing if they have the virus or not, and that's how the community spread increases. So let's improve testing and improve the availability of PPE as well to medical personnel, because they are those on the front line. And if this is done, the spread among medical personnel will reduce, and also the community spread will be curtailed.
As it is now, I think we can still ramp up efforts in testing people using cheap methods. Senegal has been able to develop a cheap testing kit for as low as $1. That's about 400 naira now. It will enable the Nigerian government afford that, and also make it easy and cheaper to test other people within the communities, especially the rural communities, because community transmission is now on the rise. We also need to get more human resources in terms of personnel to help with the testing and treatment of people at the isolation centers. A lot of isolation centers are currently under-equipped right now. I think the Nigerian government has to make adequate efforts to ensure that isolation centers are well equipped and people do not escape. We also need to do a bit more in terms of our contact tracing. Some countries even have digital ways of tracing their contacts, but Nigeria is not yet there. Whatever it is we think we can do, we need to fasten our contact tracing, because this thing spreads so fast and people are not if people are not effectively traced, it can lead to a lot more people contracting it and even spreading it to people within their families and within their localities. I admit that we might not be able to continue this lockdown for so long more, because a lot of people depend on daily living. And even people that have savings, when you don't work, the savings get depleted. So I think we should still keep going out if it is absolutely necessary, and keep the necessary precautions. We should still keep doing the necessary precautions, but we have a lot more to do.
We need to ensure that there is a whole lot of information being given out there, which is actually ongoing. But now we're tending to see a scenario where information is being warped and it's not very accurate as to what maybe the population actually understands about this coronavirus pandemic. So we have issues of illiteracy playing out, people not really having the right information, and of course a lot of conspiracy theories are going about. So we have issues where even adults who have benefited from vaccinations have now become skeptical about the fact that if and when there is a vaccine for the COVID-19, will they be willing to allow people or their wards or children be vaccinated? So this is really a problem. So what I would say is there really needs to be a heightened impact or effort to ensure proper risk communication at the community level. Reaching out to the people who are in not so developed areas, urban slums, down to the grassroots where we have primary healthcare centers and stuff. So a massive, aggressive risk communication needs to be done, and of course, it needs to be done in the various languages in Nigeria to ensure its penetration down to the local level. So that is very important, and of course, we also need to ensure our health systems are strengthened. We, especially down to the primary healthcare centers. Enough of this corruption that is going on. We really need to stand against this and say, let there be value for money. Let the government actually say what they mean and mean what they say. And enough of all this smoke screen of what is being done. We need direct results. We need visible, concrete actions being taken. The procurement of personal protective equipment being used exactly for what it is. People who make inquiries get the right treatment from health workers. They aren't turned down. They aren't discriminated. Health workers are adequately and really trained in order to attend to people, and of course they have good benefits packages.
We should begin to build the capacities of our hospitals, both in the communities, in the states, in the private sector. Our hospitals should by now be equipped to handle cases going by the behaviors of the previously treated people. We should now know what medications to take, what are the things to build our immunity, so that we can build resistance to COVID-19.
Lockdown, I don't believe is the answer, because that is what is causing people to, so to speak, rebel and not do things the right way. I would, after educating and sensitizing, we would look up how it would fit a particular community. The main issue here is, as they said, social distancing, the personal hygiene, the wearing of the masks, and the washing of your hands all the time. We now try to incorporate that into our daily activities. The banks will still be open, but there should be that social distancing enforced. So long as people don't see their livelihoods are being threatened, there is more, there's a chance of people to be more obedient. The bigger problem we are facing right now, I think, is interstate travel. People are still traveling from state to state. I don't know if the authorities know this, but definitely somebody knows this. Recently, we had somebody, a former high-ranking person that traveled from one part of the country to the other, and this is all over the news, and nobody's saying anything about it. Nobody's calling him to order, much less other people. So I think the focus now should be on really making each state to be self-isolated from other states. The borders are still porous. That's what I want government to concentrate on. There should be a lot of heavy repercussions for those crossing borders. There should be a lot of heavy repercussions for those allowing them to cross the borders.
NCDC is doing very well, but if I would encourage states as well to try to invest more on independent testing system, so that is going to complement the effort of the Federal Ministry of Health and the NCDC, because definitely if we all rely on NCDC and Federal Ministry of Health soon, they are likely to be overwhelmed. In terms of health promotion programs, I don't think, the media has been very effective in trying to project this, but in a multicultural population like Nigeria, a more drastic and unique approach needs to be taken. It's not everybody that has access to the media. So I think stepping down these health promotion programs is very effective, and engaging professionals. There are many professionals who are willing to help in this aspect to step down this, and this will be more effective in rural communities. We can see what's coming up in the north. You understand, for instance, in northern Nigeria, that provision of palliative and asking people to stay home will not be effective. I didn't say it may not. It will not be effective because these people, the language they understand is not just the food, nor stay at home. They need to be taught things about these diseases, about this particular disease, So I think stepping down this is going to be very, very effective.
Every human being that came into the States through the airlines would test each of their incoming that have high fever. So as you're coming into the States, or into the country, you have high fever, you're being tested. You're being tracked as you go back home, and you're being you are going to self-isolate as you're entering into the state. Whether you came in or whether you came in from the country, as long as you flew at that beginning, you're supposed to self-isolate. Religious leaders, especially in the northern part of Nigeria, and their emirs are going to be well engaged to make sure that they sensitize their citizens very well, and each of the citizens are going to make sure that they follow the rules and regulations very well, because especially in the northern part of Nigeria, the cases are becoming way too much. So my strategies would also be to involve tech companies, private companies, to provide solutions to make sure that the economy does not go down.
Thank you so much for watching. If you haven't already clicked on the subscribe button, what are you waiting for? Please click on it right away and support a sister. I'll leave you on this note. While it is unfair to compare capabilities amongst different countries, there is still an expectation that strategic courts should be cut accordingly. One does not hope that these strategies take the vulnerability of the common man in our society into consideration. It is simple. The more exposed we are, the more this deadly virus will spread. We need to help ourselves by supporting our leaders' efforts. Compliance is key, as the collective vision is that we will all survive. Until next time, please stay safe. I remain safe and smart. Signing out. Take care.